The Diskus is a dry powder inhaler, or DPI, that contains multiple doses of medication within this case. Before using the Diskus, make sure the counter shows available doses. Do not prime the device. Hold the Diskus parallel to the floor with your left hand. Place the thumb of your other hand in the indentation, which is called the thumb grip, and push the thumb grip away from you to expose the mouthpiece until you hear a click, which indicates it's open and locked in place. Slide the lever away from you until it clicks to load the medication. Never shake the device because the fine powder may spill out. If you accidentally drop the device after loading the dose, then you must start over because the powder likely spilled out. Holding the Diskus with both hands like a hamburger, but away from your mouth, breathe out gently but completely. Never exhale into the Diskus because you may blow out the powder or the moisture in your breath may gum up the powder. After exhaling away from the device, seal your lips around the mouthpiece. Do not use a spacer with the Diskus. Inhale or breathe in quickly and deeply through your mouth until you take a full deep breath like this. Move the device away from your mouth. Hold your breath for up to 10 seconds or as long as possible. Then breathe out slowly. Place your thumb on the thumb grip and slide it back toward you to close the device, making sure it clicks shut. If the Diskus contains an inhaled corticosteroid, rinse your mouth, gargle, and spit. Do not swallow to reduce the risk of a fungal infection in the mouth called thrush.